Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Laura Vasquez is the Family Medicine Board Certified Nurse Practitioner through the American Academy of Nurse Practitioners, practicing with the Reardon Clinic in Kansas. Her focus is on integrative oncology and other complex conditions, and she provides support to patients in all phases of their treatment. Laura has recently become certified in the Metabolic Approach to Cancer after completing the Practitioner Master Course. She continues to learn cutting-edge strategies and collaborates with a network of like-minded providers, paving the way for a new approach to cancer care. Over the years, her passion for integrative health has continually grown as she sees the value of natural therapies in the changing landscape of modern medicine. She recognizes the importance of evaluating underlying contributors like inflammation, infections, and environmental toxins to support patients in their journey towards real health. In addition, Laura has vast experience with intermittent fasting, ketogenic diet plans, and lifestyle education. Laura's first love is spending time with her kids who enjoy cooking food, being outdoors, playing sports, exercising, reading books, and playing card games. Laura, what an absolute honor it is to welcome you to Boundless Body Radio.
Thank you, Casey, for having me.
It's such an honor to have you. You've had some recent life changes, and so I had to make a little kind of an on-the-fly edit, and I'm not fully confident that I did it right. Do you have kids?
Yes.
Okay.
I have two kids. My son's 13 and my daughter is almost 9.
Okay, that's awesome. Yeah, great. During the introduction, when my music is playing live, I can't go back and edit things out, and so I was just like, I changed it on the fly. Like, I better make sure that's true.
Right? Yes.
That's
yes,
fantastic.
2 wonderful kiddos.
That's great. It sounds like you guys have a fun time playing outside. We mentioned in the introduction you're in Kansas, correct?
Correct.
Yeah, that's awesome. Cool
Yeah.
place. I've been through there. It's there's actually kind of a lot to do. I think it's a bit of a gem that not many people know about.
Yeah, I'm located in a suburb of Kansas City. So we're on the Kansas side, but it's a big city. Of course, we have the Chiefs and we're a big sports town, and there's a lot of, it's really grown in the last 20 years, different areas of Kansas City. So there's a lot of fun things to do.
Yeah, that's fantastic. Our soccer team here, Real Salt Lake, definitely has a strong rivalry with sport in Kansas City. We've had a lot of battles with your sports teams there, so very familiar with Kansas City.
Yes.
Well, we are talking about a subject that's very near and dear to both of our hearts. My mom passed away. I don't think it's that bold to say I don't think she died of cancer. I think she died of the treatments. That was my experience. She was diagnosed with breast cancer. She survived for 7.5 years. And we got involved with the Race for the Cure. And so every year we would do this 5K race for the cure. Everybody would have the tags that they would say like who they are remembering, who's passed on, or who they know who has cancer. And it was like huge groups. And we did it for so many years. My mom was like an honorary chair, and we did these weird speeches and stuff like that. And then we ran so many 5Ks over so many years with so many groups in so many cities. Why are we still talking about cancer? Like, did that make a dent in anything that we're finding as far as cancer treatments?
That's true. Well, and like you said, I'm so sorry for your loss. I feel that everyone's lives have been touched with cancer. So whether it's your, spouse, your family member, it's an epidemic. It's only growing, unfortunately. There are a lot of new targeted treatments that are coming out that are hopeful. And I know they continue to research and raise money, which is valuable. But there's a lot of other things we can do to support the patients, what we call their terrain, and optimize their whole health wherever they're at in their cancer journey. Maybe they've just gotten diagnosed and they're trying to decide on, the right course of treatment, or perhaps they're more advanced and they've had a lot of toxicity to the body because of those conventional treatments, and they haven't been able to support, their healthy cells. And you're right, it can be a really aggressive disease process. And so we have found, and just with evidence, trying to figure out what the right combination of treatment is in terms of conventional, maybe it's surgery and maybe some form of chemotherapy or an immunotherapy, figuring out that combination, and then all that we can do integratively to support, we see the best outcomes. And, our goal is always for a patient to get into remission. And sometimes that's not the goal, and it's more of quality of life and extending that life for that time period.
Yeah, well, I think that's just as important. And that's why I love talking to people like you who are out there, trying different things, not the conventional norm, or at least using different adjuncts to help with cancer. I think is wonderful. So I'm so excited to have you on today and to hear your story. Before we go there, I do have one personal story. Can I tell this with the Race for the Cure? So,
Absolutely.
okay, so it's 2006. I'm in Denver. It's like Sunday morning, and all of a sudden I hear a band outside my hotel. I'm like, what the heck's going on? I go outside. I realize they're running the Race for the Cure. They're just doing it at a different month than we had done it in Salt Lake. And this is like months after my mom had died. So this is really fresh. And I see that there's no way I'm going to make it to the start line, but I'm close. So I'm just going to throw my running shoes on. I'm just going to jump in and run with these people. So I start running. It's pretty emotional. It's my first run after, my mom had passed.
Sure.
So kind of waterworks going on. I look around, I have this really fleeting thought, but like, wow, there's a lot of women out right now. I finish the run, get to the kind of expo area, and try to get back to my hotel. But the start line is packed with people. Like all these people are staging like they're going to run the race. I'm like, what is going on? Like, I just need to get to my hotel. It's just a few blocks away. And they come over the loudspeaker and they say, thank you, everybody, for participating earlier today in the women's only run. It was a wonderful event. Yeah.
That's a great one.
First place. I took first place in my divisions, the
Of
male
course. No,
division. Oh my goodness.
that's
So
great.
embarrassing. So embarrassing. Okay, enough about me. Let's hear your story. It sounds like you always wanted to get into the medical industry.
True. Yes. So my mom is a retired registered nurse. She had a career in specialized in cardiology with the health system, and I followed her footsteps and obviously became a nurse and then got my master's to become a nurse practitioner. But when I was little, I would say even as young as 3, if you asked me what I wanted to be a pediatrician because I love kids, even though I was obviously young myself. And I loved my mom's stories of the hospital, the patient and the medical, everything that had to do with the disease process and treatments. I used to go up to the hospital and look at the EKG machines and have her explain that to me when I was really little. And so it's just always a passion and something I felt really called to do. And I was really fortunate because a lot of, people are exposed to different things as children. And that was something that I always knew that was the line of work I wanted to, go into medicine and some specialty.
Yeah, that's fantastic. How did you know you wanted to specifically get involved with cancer itself?
Yeah, how life works. Stuff kind of happens that you least expect. It was actually something and I've never probably said this out loud, but in nursing school, I was placed for my pediatric clinical at Children's Mercy on the oncology unit. So this is obviously children with cancer, and I have a very soft heart. And so I was crying at clinicals. I mean, I was really struggling to get through the day. And it really scared me to see, how cancer was impacting their lives and cancer itself. I mean, we still don't know. There's a lot that we don't understand about it. And so it really scared me in terms of, that, I guess, that disease process. And so I ended up going into cardiology originally, and I did about 10 years of working at a conventional health system. And I ended up as a nurse practitioner doing preventative cardiology. So risk factor modifications, blood, diabetes management, cholesterol, lifestyle risk factors, helping patients with that because I've always loved prevention. And when I was around 12 or 13, I got really interested in nutrition and understanding how that impacts our health. And I've always played sports, so love to exercise, and the nutrition part came with it. I started receiving acupuncture myself when I was in high school. And I really was interested in how acupuncture works, more of the Eastern modalities, that adjunctive care supplements to feel your best and really, again, prevent disease in the body. So 2 years ago, I got out of conventional medicine about 3-4 years ago. I took a leap of faith. I said, you know what, I love working here. I love my patients, but I wanted more for them. I wanted to really do more in-depth testing, look at the whole person and be able to work in a more integrative capacity. So I just pretty much took a leap of faith, and I connected with not the Reardon Clinic yet, but I went to another more functional medicine practice with a chiropractor who really taught me a lot about the testing. And we did IV therapy, chelation. So we did a lot of more functional medicine, integrative type treatments. And so I learned a lot there, and I just took some classes, did some certifications. This job fell into my lap. I was the last to interview for this position, several candidates, and it was just the right fit for both of the clinic and myself. And that's when, I was, like I said, I was intimidated by the oncology aspect. However, I felt like this was right for me, and I was put in the right place. So I took the job, and I've been here 2 years and absolutely love it.
That's amazing. Yeah, life is funny that way. It took a global pandemic for us to start our business, or we wouldn't even be talking today. So there's so many
Right.
weird things that transpire in our lives that lead us down the right path. That's so cool. So I want to ask about some of those integrated practices. You had experience with it, growing up, and it's something that you wanted to do. Was there also a component that like, did you feel like the patient wasn't being served as well as they could have, or maybe the results weren't as good as you thought they could have been if you could add in some of these other things?
I am so sorry. There's a spider that just dropped.
Well, this podcast is over. We're burning your office. Spiders, absolutely not.
That's why I'm trying to talk, and there's a spider was like dangling. I'm sorry. Can you edit that out?
Yeah, for sure.
Okay. That was scary. So sorry. Can you say that one more time?
Yeah. So the question was around like you had experience with integrative therapies. And so obviously that's something you're always going to want to do. But did you feel like the patients were like underserved or not getting really good results because that component wasn't there?
Correct. I always felt that there's a place for what I would call conventional treatments. And that's cardiac too, or whatever disease process, medications, or there may be a need for surgery. I'm glad we have those tools. I'm very experienced with certain aspects of that. However, I felt that our patients, we weren't always getting to the underlying cause or the root of dysfunction in their body. And so we were using a lot of things to mask, putting them on medications, maybe not doing as much education, or more natural therapies. Diet modifications are huge. I mean, diet's foundational to our health. And I know you believe that and understand that. And so I really wanted to be able to serve my patients in a different capacity where I could educate, work with them, and really help them make significant changes, because the body wants to heal. And we know that the body's made to heal. And so I really wanted to help them. That's really how I wanted to serve my patients, is more of a natural way.
Yeah, I love that. That's so cool. So okay, so maybe like a really high level. What do we know about cancer, and what do we know that we don't know? If you're trying to explain it to somebody that would maybe have never heard of it before, what kind of things would you talk about as far as cancer?
I would say, it's come a long way. It used to be more of a genetic. We had a model that it was more of a genetic basis for the development of cancer, of why people would get cancer. However, there's been a lot more research and understanding that it really is a metabolic dysfunction going on in the body. If you think about our mitochondria of our cells, our little powerhouses that, keep our cells healthy, there's a lot of mitochondrial dysfunction going on when patients develop cancer. And so there's this new research coming out that really shows us it's not just a genetic basis. There's a lot more going on that contributes to the development of cancer.
Do we know the cause? Do you know how cancer starts?
We know that these are rogue cells. These are your own cells that become DNA damaged. And that's when you start developing this, and then the cancer puts out signals. It's really smart. It can evade our immune system, puts out signals to the body to develop blood vessels, to get fuel, such as glucose is a main fuel source for cancer cells. And the way they use it is different than our normal cells. So there's all these different, it's just these rogue cells. It's your own cells that become abnormal. And then the more that they proliferate, that's when you'll have symptoms, or you develop a tumor or get a diagnosis. So it's hard to catch early on because this is microscopic and we don't know, and unfortunately, if this is going on in your body, but there is a lot of diagnostic, colonoscopies, mammograms. I mean, there is a lot of diagnostic tools that can detect it earlier. Yeah.
Yeah, that's well explained. I like that. So I just lost my question. 2 minutes. Okay, I've heard this a lot. I'm not sure if it's true. Would you say that all of us have some level of cancer in us pretty much all of the time, but our immune systems, if we have good immune systems, they're strong enough to pick up on that and make it not be a problem?
Absolutely. And I think a lot of people don't think of that, or don't have no knowledge of that we're making cancer cells every day. We have cells that are becoming damaged, maybe from carcinogens, toxins in our environment. Stress is huge too. We have oxidative stress going on. Our food supply can be really toxic. So, whatever chemicals we're getting from that. Yeah, so we have these cells that go bad, but you're right. Our immune system is designed to detect these cells and get rid of them. And it does do that. But when you develop cancer, I always tell my patients, no matter what type of cancer, you always know that you had some form, I would say, of immune dysfunction underlying that. Definitely one of the contributing factors, so your body wasn't able to either make enough of the right type of immune cells like T cells, B cells, natural killer cells to actually detect and get rid of these before you developed, a bigger problem, actual cancer. So the immune system is very integral in preventing cancer and treating cancer.
Okay. Wow. Yeah, that's also well explained. I don't think this is knowable, and I know this isn't your wheelhouse, so I'm just asking you to maybe speculate. Would you say that cancer is a modern disease? Like, do you think we've evolved with cancer over, the 300,000 years that we've been Homo sapien, like, or is this something more modern?
No, I believe, I mean, even as far back as we can tell, there was people had cancer.
Okay.
So I don't think it's a modern disease. I think how I view it is, but I will say on that note that more and more young people are developing cancer. So it used to be a disease in an older population, because we know that you can't repair your cells, or you don't rejuvenate, your body as we age. There's a lot of, the aging process in general is a contributor of cancer, and still is, but younger people are getting cancer. And I have to say, we do see a lot of toxicity. Our environment's really toxic.
Yeah.
The quality of the air, the water, the food, plastics, pesticides, or I mean, all this stuff we're bombarded by, EMFs. So it's like all this stuff all the time that our bodies, human body, I don't believe was designed to handle all at once.
Yeah.
Another factor is stress and how you manage stress, because stress actually decreases your immune system. It depresses your immune function. And so we know stress, people, say stress is bad for you. Well, I never really understood, how is it physiologically affecting us if it's an emotion? But it actually has a physiological effect because our mind and body are connected. And
Yeah.
so when you don't even realize what the stress is doing to you until it's too late. And then you look back and think, most of the cancer patients I work with, I do ask them, did you have an extremely stressful experience leading up to your diagnosis? And that could be, a divorce. It could be loss of job. COVID was very stressful, as we know, for the population. So all of these kind of more major stressors, not just like an everyday stressor that we all have to face, whether it's something small. So I would say a lot of our patients, they can pinpoint a very specific, loss of a loved one, that was sudden, a very specific time, a year or two prior to their diagnosis. And so I do believe that's a contributing factor, among other things, to the development of this.
Wow. So more often than not, they will identify something again, like a year or two, that was like one of the heaviest kind of stressful periods in their lives.
Absolutely. Or they had like a really, perhaps maybe they're in a bad relationship. Maybe it's toxic, abusive, and they've got children, and they've got kind of a chronic stressor that's been going on for like 5, 6, however, whatever period of time. I do find that quite a bit, because I ask that question. It's very important for us to look at all aspects of their body and their health. And so that's one of the factors we want to, inquire about. And if that's something that shows up as a pattern for them, that's definitely where we want to intervene and figure out how to mitigate their stress if they're still going through it, or how to heal to do maybe trauma therapy or whatever will help them process that emotion and let it go, so to speak.
That is absolutely fascinating. I've never contemplated that, but that does not surprise me in the least. I love that you've been asking that question and, at least seeing, lots of correlation. It doesn't say
Yep.
it's a cause, but when you see tons of correlation, you're on the right track. So, okay, so you mentioned cancer cells as a metabolic disease. We know that it's something's going wrong in the mitochondria. Some type of environmental toxin basically makes the cell break. And cancer is not an advancement in any kind of technology. It's actually, the cancer cell reverting back to an ancient form of metabolism, which is fermentation. So
Mhm.
we know that cancer cells ferment even in the presence of oxygen, which is a little bit weird. We should be using Fox ox system to be able to use oxygen as energy. It's much more efficient. Cancer cells don't do that. So
Mhm.
knowing that, how does that give us clues to what kind of fuel sources cancer is using?
Gosh, that's a great question. Well, we know that they utilize glucose is the main fuel source. There's studies on methionine amino acids that cancer cells can use. I think that hopefully we'll continue to get more substantial research so we understand all of the different fuel sources. But cancer, I see it as everyone's cancer is different. I would say not two people that have pancreatic cancer or breast cancer necessarily maybe have all of the same causes that caused it.
Hmm.
Um, and everyone's cancer has their own DNA signature. So it's just highly variable. I feel like that's that's why it's hard to treat.
Interesting. And that's why all the genetic testing we've been doing in the last decade or 2 decades we thought was so promising is actually led us to this point of like, wow, the signature is so different. You could have two people, same cancer in the same waiting room, and it's completely different.
Exactly. And how do we test for that? How do we figure that out? If these cells are using these fuel sources, or that way we can treat it. There
Yeah.
are a lot of effective treatments out there, but like I said, it's what we do is we really try to look at that patient and figure out what patterns are we looking at, what are the dysfunctional patterns for that patient? Because like I said, it's never quite the same from patient to patient.
Okay. Gotcha. We've interviewed Dr. Thomas Seyfried twice on the show. He's a cancer researcher out of Boston University. He's such a
Yes.
great guy. I love getting him like worked up on stuff. So the last name of the episode name of the last episode we did was cancer is a revenue creating disease. And I just think it just hits you to the bone that like this is a disease that's generating revenue for a system. And so they're going to continue treating it as this kind of system for a long time because it makes a lot of money. So again, tough to think
Yeah.
about, but he'll maintain that the two major fuels of whatever the minor fuels are, but the major fuels of a cancer cell would be glucose and glutamine.
Mhm.
Glucose, non-essential, we don't have to eat it. We'll make just the right little amount that we need if we don't do that. Glutamine is a non-essential protein, which means we're always making it. So that becomes a little bit tricky. We need some type of therapeutic advancement to be able to treat cancer that way. But
Right.
but knowing all of that, nutritionally, what have you learned about changing somebody's nutrition, even just basic stuff that can typically work across the board, regardless of the individual types of cancer?
Yeah, great question. Diet is often the hardest part for our cancer patients, or probably, I would say just general, because diet, you have to figure out, what am I supposed to eat? Where do I source it? How much do I eat? So it's really complex, and it's not as simple as taking supplements or going out on a run. So it's very, really, and how I see it with our patients is there's an appropriate diet, so to speak, for that patient, and what their biomarkers, when we do our testing, what that shows. If they have a lot of metabolic dysfunction, some of those markers are elevated, then we may want to do more of a Mediterranean / ketogenic diet. So really, low carb, of course, lower starch, vegetables as well. And so diet is so foundational to our health. It's the building blocks of our healthy selves. And figuring out for that patient, like I said, do they need to be on more of a ketogenic diet because they have brain cancer, which we know works as the best diet for them to be on? Or do they have prostate cancer? And we know we really need to be careful with a lot of meat, especially red meat. So we'll want them to err more on heavy vegetable consumption. but still getting good quality if they're going to, have meat, still getting good quality meat. And I think the quality of the meat is, for me, with my patients, getting something that's grass-fed, grass-finished, avoiding the antibiotics in the meat, so trying to source the best quality of fish, meat, chicken, eggs. For me, that's just the most important for our patients.
Yeah, I agree. I think if it's cost prohibitive, that's tough. I'd rather still somebody
Mhm.
have meat that they can get at their local grocery store if they can't afford grass fed. But yeah, I love the grass fed beef that I get from a farmer in Nevada, which is really great. He
I
ranches over
love
there, and I
it.
get to buy a quarter cow from him. And I know that the cow lives its entire life and dies on the exact same property, has a very happy life, and the meat I think tastes way better. I think it's great. So
Yeah.
what have you noticed anecdotally about ketogenic diets? The people that do tend to do well with them, have good compliance with them. Are you seeing good results with that?
I think a ketogenic diet is, at first, if you've never understood or practiced it, it does take time, and there's different ways to kind of slowly ease yourself into that. But absolutely, we'll see metabolic markers improve. So, like IGF-1, insulin like growth factor, is a fuel source that cancer cells can use. So we'll see that improve on a ketogenic diet. If their fasting insulin tends to be high, we'll see that improve. Obviously, blood sugar control, their A1C will come down. They often lose weight, and obesity is a risk factor for cancer. So if we've got some and inflammation, and it's all connected, so we'll see weight loss. They often have less side effects on the chemotherapy. They've got their cognition's clearer. They have more energy when they're utilizing ketones. And so we're really, and again, it just depends on the type of cancer and their biomarkers. If that's something I really strongly feel would be, when looking at the big picture, is the right diet for them, because I don't think it's a one size fit all approach necessarily. And honestly, I don't believe that they need to stay on that for their lifetime, because they'll ask, do I have to, eat in a ketogenic style for the rest of my life? And I tell them, no, let's get through this and let's monitor you. And then we'll adapt and we'll add in some complex carbs, or, more meat, or whatever we're trying to modify. So there's just, it is complex, but it's so important. It's just such an important part of what we do to help our patients.
Yeah, that's cool. Yeah, I would love for somebody to be motivated enough to stay on a ketogenic diet for all of the benefits. I understand that people can't do it. If they could
Yeah.
stay at least in some type of a realm of a low carbohydrate diet and work
Mhm.
on what things can we add back in, I think that's fine. I do see a lot of people slip up and then they go right back to where they were, which is tough. And we've also had Travis Christofferson on the show, and he explained to us how cool ketones themselves are, because it's almost like two ways. It's like, number one, if you're ketogenic, you're not making glucose, you're not intaking a lot of glucose, so your blood sugar
Mhm.
is probably well controlled. You just cut off a major fuel supply for cancer cells. But it's also beneficial because now you have this alternate energy source. Cancer cells, as we know, can't use, but some of the other tissues in our bodies can and actually thrive
Correct.
on them.
Yeah. Yeah. There's so much good research on it. And, fasting's a great way to, add in the fasting to get yourself in ketosis. It's really an adjunct way, not only with the food you're eating, trying to get those healthy fats, because it's primarily a healthy fat diet. But then, fasting and doing intermittent fasting. And we do even more prolonged fasting education with our patients, especially when they're going through chemotherapy, because the research shows how beneficial that is.
Yeah, absolutely. I'm so glad you went there. Intermittent fasting is how I found the low carbohydrate space to begin with. I worked on metabolic carts for over a decade, and we knew that if you did a calorie restricted diet, you would crash your metabolism. Your metabolism would be lower at
Mhm.
rest than it should be. And I would have people do intermittent fasting, and they'd come in to do these assessments, and their metabolisms were really high, but they were still calorie restricting in a form, but they were restricting the time that they were eating. I could
Mhm.
not explain it. It was so difficult to try to understand what is so different about these people that have really high metabolic rates, higher than normal, and the fast or the diet people have lower than normal metabolic rates. What's the difference there? And understanding the physiology of how special fasting is. Can you talk about how you found fasting yourself? Like, how did that come to your mind?
Yes, I well, just listening to, education, some of my mentors teaching me. So I started learning about intermittent fasting about 5 years ago. One of the physicians I worked with in the preventative cardiology clinic, he had a lot of knowledge on intermittent fasting and the benefits for our cardiology patients, because, with heart disease, it's really mostly about inflammation, but it's a different type of inflammation. And so
Yeah.
we did a lot of education. So I started reading books. He was educating me, and I just got really interested in it and wanted to learn all about it. And so I, of course, started practicing that about 5 years ago. And I do typically, give or take, about 16 hours a day. So I try to do that as best I can. And I think people that have never, or it's a foreign concept to them because they're used to breakfast, lunch, dinner, they may be eating a bedtime snack. I mean, that's how I pretty much grew up, 3 square meals, snacks. I think people, it's a little anxiety provoking because they're not sure like how they're going to feel. But I always tell people, start maybe doing 13 hours a day if you can, then 14 hours the next week, and then 15, and then try to get to 16. Research has really shown that the benefits really start after about 13 hours. So if you can kind of get to that threshold and you can go over that by a few hours, that's when you're really seeing a lot of the benefits, reduction of inflammation. Our body can get rid of our old damaged cells, right? So, and protect our new cells. There's just so many benefits to it. So yeah, I started practicing it. I honestly don't really think if you're just doing intermittent fasting, you probably won't see like a drastic weight loss with that, but all the other benefits are numerous. And so I loved it for myself. I felt more energy. I just felt clearer. I slept better. My skin looked better. It was something that I could tell my body was really, how can I say this? It was very natural to do. Like we should be doing this.
Yeah, absolutely. I was going to ask you what benefits you noticed personally by doing intermittent fasting. That's fantastic. Were you surprised for something that seems absolutely miserable, going so long without food, all of a sudden becomes so easy and desirable, and like, oh my goodness, the bread, like just making the meals practically is like such a nightmare. Isn't it so nice, like practically to be okay with fasting?
Yeah, you don't even have to think about, I don't have to I don't get up. I used to be a big breakfast person, but I've noticed my appetite changed with fasting as well. I didn't feel mood swings throughout the day as much because you're not having that glucose spike or the insulin. So you're more even keeled. I think my mood was better, but yeah, it's something so easy and natural that our bodies honestly were designed to do. So if we can start, implementing just the intermittent fasting, a lot of benefits. And then again, with our patients on chemotherapy, we actually will try to have them do anywhere from like a 48 to 72 hour fast during the chemotherapy session.
Okay. Yeah, that's fantastic. And you mentioned you growing up, like breakfast, lunch, dinner, bedtime snack. Like that's nobody in America anymore. We're talking snack, breakfast, snack, first lunch, snack, second lunch. I saw some stat. I can't remember what the number was, so I'm going to botch this. But I think the average American eats like 18 times a day or something. Like
oh my gosh,
it's absurd. If you count all the individual times they're putting something in their mouth, for a period of time, it's up there. It's something like that. It's nuts.
Well, it
So
reminds me of my kids because they eat how kids are, but they're growing, right? They're more
right.
active. They're not at a desk job, but they're every 2 hours they're hungry. So we've tried to give them healthy snacks, but adults don't need it. An adult doesn't need to be eating that much.
No, this is why we store fat. This is exactly why we have stored body fat. We adapted to that so that we could go long periods of time without having to eat. And we get sharper. We get in that ketogenic state, like you said.
Mm-hmm.
People think they're going to be miserable and feel like lethargy and feel terrible. You actually feel better. You have your best workouts when you're fasted because your brain is using those ketones and you're thriving. And like, if we would have died of hunger because we had so little energy because we couldn't kill something, like that helped activate that and increase that. So I love intermittent fasting. I think it's an awesome practice to do. You mentioned 48 and 72 hour fasts. Are there any other like extended fasts that you guys recommend specifically for what you mentioned, which is autophagy, which is the body eating itself is literally what it means. It's taking care of things. We hear the craziest stories about people doing fasting as a practice and all kinds of things being resolved automatically. Like you said earlier in this conversation, the body wants to heal.
Yes. This is a good story. I've got a couple patients who And this is not what we've recommended to them. They've decided, they do have breast cancer. They've decided to forego conventional treatment for the time, and they want to do a more natural approach. So we do help support them. We educate them on the risk of, if we're not going to get surgery to remove the actual tumor, or, perhaps even entertain the idea of targeted radiation, or, so, but these patients, I've got 2 women, and they're very strong-willed. And one, she did a 40-day water fast, and it was supervised. I wasn't supervising her. She had a fasting coach, but her tumor, she's able to monitor her tumor, and she can tell when it's stable and when it's growing, depending on what she's eating and how much she's fasting.
Wow, that's
So
fantastic.
she changed her diet sometime in the fall. Before I had met her, she had been a vegan, and doing several extended water fast throughout the year. And she's been living with a breast tumor for about 2 years. And
Oh,
so
wow.
she decided she wanted to incorporate dairy and meat again. And as soon as she did those, both of those, added those back to her diet, her tumor started growing, and she could
Wow.
feel it.
Wow.
And so she immediately stopped, and now it's not gone, it's stabilized again, so to speak, from what we can tell. But yeah, I mean, just some of the things I've seen with fasting. And like you mentioned, or you had asked me about not just intermittent fasting, or, fasting with, just liquids and no food during chemo. Fasting mimicking diet is sometimes a great way for our patients if they have metabolic issues, or, we're helping them with it through their cancer journey. I will have them do that perhaps maybe once a month, do like a 5-day. So they're still getting some caloric intake, but it's very low. And there are certain foods you will eat on that diet. There's companies that offer that. I'm sure you know about it, but you can do it on your own. So great research with that, the fasting mimicking diet as well. I mean, you really are in a state of fast, even though you're having some substance or caloric intake.
Yeah, so many different ways to approach it, which is
Mhm.
what I love, and it is individualized. You are talking to a large audience who does the carnivore diet. Like, I've been a carnivore for 4.5 years now. So literally, I mean, I've cheated here and there, but I have not had a vegetable in 4.5 years. And lots of people that I
Wow.
know that are on this type of diet have come to this diet for some kind of healing. It could be that, maybe fruits were difficult because the way that we breed them, and they just kind of now, like sugar bombs that are available 365 days out of the year. They're not seasonally available like they used to
Yeah.
be. Or maybe they struggle with vegetables. Like, we have lots of people that we talk to that struggle with oxalate or leptins or phytates and some of these
Sure.
phytochemicals. Would you be worried about somebody doing a carnivore diet for various health reasons? Would you be worried that they weren't getting enough nutrients?
That's such a good question. We at our clinic here, we do nutrient testing. So we actually will look at like a 3-month storage of nutrients in your cells. So all of the, antioxidants, vitamins, minerals, amino acids, fatty acids, like your omega-3/6 balance. That's some of the testing we do on our cancer patients and just general chronic disease patients. So I think, no, I think different diets work. I think different diets can work for different people depending on why they're doing it. And also, your genetics play a role in, what type of foods may be best for you. And that's hard to always figure out. I do tell people to try, we may try a certain, maybe more a diet type modification, and we'll see how they feel. It's a great, if you're in tune with your body and like, I feel great energy. I've lost weight, like this is working for me. Cause like I said, it's not one size fits all. So no, not necessarily. And if someone was doing the carnivore diet, I mean, I would say perhaps maybe even checking their nutrient status after they've been doing it for a period of time. So we can make sure, that they are getting, maybe for perhaps we need to supplement with vitamin C, right? Because
Yeah.
we don't synthesize vitamin C. So that's something I do find that's very low in the storage form in the body. And we need vitamin C. It's a very important cofactor for your immune system, among other things. So you can supplement with other antioxidants and nutrients if it's needed.
Okay. Yeah, it's a little bit more of a targeted approach. Do we need more vitamin C if we are taking in carbohydrates?
I would say this is really interesting. When your body when you're chronically sick, let's say you have a lot of inflammation going on, oxidative stress, your body will require more vitamin C and vitamin D. And so animals actually synthesize vitamin C. And when they get sick, their body increases the production of vitamin C. So
Interesting.
yeah, so we don't have that ability to do that. We lost the glow gene about 2000 years ago. So humans used to make their own vitamin C. Like we can synthesize other nutrients, of course, vitamin D. So we really need vitamin C is so important. So we really need to make sure if you're not, consuming a lot of fruits that are higher in vitamin C or other foods like greens that are high in vitamin C, that perhaps you are getting, taking some vitamin C every day.
Yeah. Okay. Well, I really appreciate that. I know carnivore isn't necessarily your wheelhouse, so I appreciate that. We love it and we promote it. And we talk to other carnivores, and they tell us, you don't need as much vitamin C if you're eating, whole meat and maybe getting some organs in. And as much as I want to just have the one diet be the one thing for everybody and go around and tell everybody this is the best, just do this and you'll be fine. You're right. There's nobody who can say what diet will work for which people. I think a direction could work for a lot of people, but I don't know how you're going to do. I don't know how somebody down the street is going to do. It's unknowable. I could never know that.
Right.
And so being able to try different things, like you said, and be willing to pivot and be willing to be wrong about stuff. Like I've been wrong about nutrition for 16 years now, one way or another. It's tough, and it's humbling, but that's really important to consider. So I really appreciate that.
Yeah, I've worked with a lot of patients with autoimmune conditions. And I will typically have them start an autoimmune paleo diet, and they do fantastic.
Mm.
I mean, their autoimmune markers will come down, their symptoms improve. They, if they need to lose weight, they typically lose weight. And so they're doing more of a paleo type, in their elimination diet. And so they don't have to stay on it forever necessarily. But I found that works really well when you've got that kind of disease process going, if you can change over to that and stick to it, which is obviously the consistency part is really important with diet. But
yeah, the big takeaway of all of this, if you're shopping in the middle part of the store, you're going to have a really tough time with your health. Take your pick, whether it's cancer, obesity, diabetes. You are eating ultra processed food that is designed to be addictive, and it will hook you, and you're going to have a really tough time. If you're shopping the perimeter, you're at least getting produce if you choose to do that. You're getting the meat that you need if you choose to do that. Either way, you're choosing nutrient-dense foods that are going to be better for you in the long run. And if that is a priority, if health is a priority, you're going to skip the cookies more often than not.
Absolutely. Yeah. And I really feel we're designed to eat meat. Our bodies need that source of fuel, and, all the different antioxidants, phytochem, like you said, some people are sensitive to certain things. Nightshades are one of them, lectins. So it's really hard. Sometimes we have to just figure out, where am I at right now in my life? What are my goals? And then figure out what's the best diet.
Yeah, I love that. Any other things that we missed as far as fasting or diet goes?
I'm trying to think. I don't think so. This has been a great conversation.
It's been awesome. Fasting for me is like pretty much the gold standard for almost anything. Weight loss, mental clarity, mental health, your hunger. Like right now, I just felt my stomach grumble a little bit, and I'm hungry, but I'm not hangry. Like I'm fine. If I ate in 30 minutes or 4 hours, it doesn't really matter. It's such an amazing tool.
It really is. And like you said, for, diabetes is such an metabolic disorders in general, there's a lot of them. We could talk about cardiovascular, diabetes, cancer. So fasting is one of the main education topics and diet techniques I use with my patient, every patient.
Yeah, that's fantastic. Okay, so we've talked a lot about diet. What are some of the other ways that you're helping your patients?
Yeah. So we, as you know, and you had mentioned, we do integrative oncology. So we look at the whole person, and we want to optimize whatever dysfunction's going on. Some of the tools we use are high dose vitamin C, which has anti-cancer benefits for more cancer stem cells. It cools inflammation. It's a very cooling therapy to the body. So our patients will get anywhere from 50, 75 to 100 grams in an IV. So that's comparable, right, to like 75,000 milligrams in taking that. So you orally cannot take that much. So we do high dose vitamin C. We do mistletoe therapy, which is utilized in a lot of European countries as part of their conventional model. So that's a profound immune modulating therapy. It comes from a plant, and they take the extract, and there's different subtypes of mistletoe, and that you can do it subcutaneously or IV. And so it helps your own immune system, kind of resets it to where it's making the right type of cancer detection and fighting cells. It's an amazing therapy. It's in research, tons of evidence, on mistletoe, improves quality of life, improves side effects, just all kinds of amazing benefits. So we use that quite a bit with our patients.
That's amazing. I'm thinking of an old Saturday Night Live commercial with Phil Hartman, where he's given the cold cereal super colon blow, I think, and and as part of the advertisement, the guy talking is like, how many bowls of your cereal would it take to have a bowl of a super colon blow? And anyway, this whole pyramid appears, and it's like 10,000 different like bowls of your own cereal. I'm trying to think of that with like the navel oranges that it would take to get to that much vitamin C.
Exactly.
I've heard of that as a treatment. That's really interesting.
Yeah, it is. And the Reardon Clinic actually did some of the original research back in the 70s, which you can go to our website and look at some of the studies with high dose vitamin C and the benefits. And there's a lot of clinics all over the world that utilize our protocols that we've found work. So we'll when we give the patient, we start them on the high dose vitamin C, we will check their blood concentration to make sure they're in the therapeutic range for what we're trying to, achieve, which is more of the anti-cancer, anti-inflammation benefits.
Gotcha. And then tell me a little bit more about the mistletoe treatment. This is another one that I've heard of. I'm not that familiar with. How was that administered?
Yeah, so you can either do it. We usually will do subcutaneously. So if you think of like a small needle, like an insulin, if you were going to give yourself insulin injection, so it's administered that way, and it starts to warm your body and stimulate your immune system. So that's really what we're doing. We're trying to get your immune system back re-engaged to fight cancer on its own, which is obviously important during the cancer process and even afterwards to prevent hopefully reoccurrence. Is we got to have the immune system working for you. So mistletoe, yeah, so it's amazing. And I always tell my patients when I'm trying to help them understand the mistletoe and how it works, when we spike a fever, when we're sick, we have a pathogen like a virus or bacteria. That is our body's natural way of getting rid and killing it and really eliciting your immune response. So fevers aren't bad. You don't want it so high that you're, at risk for like a seizure or, in children, you have to be careful. But fevers, we shouldn't be suppressing fevers. If we can, we're going to be uncomfortable because we're sick and our body temperature is elevated, but it's your body's natural response. And so with the mistletoe, you can get slight increases in your temperature, typically not like high fevers, but you will, if you monitor while you're going through mistletoe therapy, you can see just like a slight temperature increase. And it just shows that, your immune system's waking up.
Yeah, that's fantastic. So it sounds like all of these, similar to fasting, are used as an adjunct if somebody wants to do conventional treatments. Is that true?
True. Yes. So we utilize vitamin C and mistletoe in combination when patients are going through conventional treatments. And it tends to help mitigate the toxicity of, say, the chemotherapy on your healthy cells. People have less side effects with their chemotherapy. They recover better from surgery, but there's a right way to time more integrative tools or therapies with conventional. We will look at both and we'll help the patient time all of that appropriately so that they both can work the way they're supposed to work.
Yeah, no, anecdotally, I can say that all of those as different tools work very well for what you said, like symptoms. Martha Tettenborn was somebody we posted on our show, and she did that 72-hour fast that you were describing right around her chemo. And every round that she did, she actually felt better and better and better, to the point that she's up and making food and, a little tired and would need to lay down a little bit more, but got through basically with very, very few symptoms and has been able to keep it at bay. So I love using some of these other technologies to kind of help us. And ironic to think that even something like fasting could be a technology that's leveraged. What other lifestyle factors do you really recommend for your people as well? We know that, nutrition is one. Some of these treatments are fantastic, but what other lifestyle things should people be thinking about that they can sort out by themselves?
Exercise. So I always think about stress, sleep. I always ask these. I ask about diet. What diet were you following prior to your diagnosis? What changes have you made? Exercise, have you been someone that's followed an exercise regimen? We ask about their sleep. That's very important. Your circadian rhythm are you on a set? Our body likes to be in rhythm. And so you really need to be eating at you need to be eating at consistent times a day and sleeping, going to bed at the same time approximately, and waking up perhaps when the sun comes up. That's really our rhythm. And then I ask about stress. We talked about that. So wanting to know, do you have a lot of stress you deal with? How do you deal with stress? But the exercise, a lot of studies have shown, especially in breast cancer, if you can get about 150 minutes a week, so it's really 30 minutes, 5 days a week, or you could do 3 sessions a week. So it doesn't have to be every day. That's when you see the most risk reduction for development of cancer or outcome improvement with cancer.
Yeah, it's ironic that the people doing nothing see the most improvement to get up to like the 25% quartile. Like somebody who's already fit is not going to see that much benefit if they go and do more exercise. The people doing nothing, go do something.
Exactly. And you don't have to go out and run a marathon. I mean, people think, if they're not someone that's typically enjoys that, I think it's stressful for them of what do I do? And I don't want to go run. I just, you can walk. I love resistance training because of, how the benefits of resistance training and developing lean muscle mass has even better, for metabolic health. And so, I always tell them like a combination of some kind of cardio, and you need some kind of, whether it's high interval intensity training, your own body weight, Pilates, whatever it is that works for you. Got to be moving. We have to be moving.
I love that. That's such a great recommendation. I was going to ask you what types of things you like to have people do. And I'm with you. Go on a walk, lift heavy things from time to time. If you don't have access to heavy things, buy a band from Amazon. They're like $30 for a set of 4. Go outside, get some fresh air and some sunshine, pull that band on like monkey bars or something. There's so many ways that people can be doing this.
Yeah, you got to get creative. I love bands. And I always tell patients that may have, joint issues and they don't want to get in the gym and lift weights, or it's just not a good fit for them, to get the bands and just do resistance, training for your legs and arms. So I love that. I love yoga for the mind body. So incorporating possibly some of that for even just stress reduction, holding poses, it's more of a static type of your own body weight, but there's so many things, and make it fun, right? You want it to be fun, so you'll stick with it. If you're doing something you don't like you're jogging and you really don't like to run, you're probably not going to stick with it.
Don't do it. Don't do it. That's great. Well, you were giving me the best segues today. You mentioned yoga and the mind-body connection. And this is something that I know we've touched on a little bit in this conversation. I know this is a big focus for you, mental and emotional health. I think this is huge when it comes to disease management. How are you able to help your patients improve their mental and emotional, their own health, I guess?
Mm-hmm. So we do work with a couple, we work with a couple women that actually specialize. One specializes in breath work. She's amazing. So she does it virtually. She's got modules. She really helps the patients get into a parasympathetic state. So we've got that sympathetic nervous system and the parasympathetic, and we typically live in more of the sympathetic state in our society in the world today. You're getting up, you're getting ready for work, you're driving your car, you've got to, multitask at work, you've got kids at home, what are you going to cook? So we're constantly bombarded with all this stuff that really puts a lot of mental, emotional stress and physiological stress. And so the breath work I love, and it's something you can do anywhere. And it's easy to understand it and master it. You don't have to go to a bunch of counseling sessions, do talk therapy and find a practitioner. Maybe you do need that. Maybe you need a combination of things, but even starting with breath work, she's done some sessions with us here at the clinic with the staff. And I will say, I've done breath work before, but never kind of this intense, her techniques. And for about 6 hours after the session ended, I was in a complete things that would rattle me or maybe cause a little anxiety. I was completely relaxed, even at work, with dealing with our patients. I went home and I could tell as the evening was going off, maybe it was I was getting out of the parasympathetic state a little bit. But it's amazing. And it's such an easy thing we can do. So I do give resources. We'll give resources to our patients where they can find someone that specializes in that if it's a good fit for them. We also work with a provider. She actually developed a course for more trauma. And so she'll help patients, and she incorporates journaling and other methods for patients to, really express their emotional or experience that emotional, I don't know what you would say, or release it, so to speak, ways like outlets that they can find. So I think putting all, it takes a combination of things. It's not just, we're going to do this one thing and take this. But I do stress that a lot. And even patients that feel, well, stress isn't probably a big deal for me. Maybe they don't realize how it's affected them. I often tell them at least to check that out or figure out what works for them.
Yeah, that's fantastic. And like you said, so many resources, people that you can work with, coaches out there, there's apps, there's
Mhm.
YouTube videos, like there's so much out there that, again, if you're making your health a priority, you can find the right information. I agree with you 100%. Breath work is absolutely amazing. You can practice it on your walks outside. There's lots of different ways to do it. For all the experts that we've talked to about breathing and breath work, they kind of have the same kind of answer where it's like, it's not doing this exact way of breath work. It's that you're doing breath work. Find whatever way, whether that's box
Yeah.
breathing, counting to 4, whatever it is, like find what works for you and just
Mhm.
just focus through getting those good breaths in and out through the nose. I absolutely
Mhm.
love that. Well,
Yeah.
it's so cool what you're doing, and you're mixing in all these different things to really help improve outcomes of cancer. I have to ask you, Laura, are you optimistic or pessimistic that we're going in the right direction as far as cancer treatment and prevention?
I would say it's hard. I see a lot of, anytime you are a provider, you lose patients to cancer. No matter what we do or what conventional treatments they've done, it's a hard disease to cure. And so it's a hard, but I would say I'm optimistic that we can start perhaps educating more people about integrative support. I wish that this was something that was standardized in our country, where patients who are going through, the conventional treatments had the opportunity to work with a provider that, understands how to support the body. Again, I really feel like the combination, you're going to get the best outcomes, quality of life outcomes, even, trying to get the disease burden down. So I'm optimistic that, people like you doing these podcasts can start, get more information or learn that there is providers out there that can support you through your cancer journey. You just have to seek out that care, but hopefully they're doing studies on mistletoe actually here in America. There
Wow.
actually is some control trials going on. So I really hope that in the future that's offered to patients, and insurance can cover that, because a lot of these therapies, aren't covered by insurance that we do. So that can be difficult for patients to be able to do it. But
Yeah. Well, I appreciate your optimism, and I appreciate you doing your part and sharing these things with our audience. We really appreciate the time you took to be on our show today. Laura Vasquez, where would you like people to go to find you and connect with you and your work?
oh yeah, so you can go to the Reardon Clinic website.org. You can also, oh my gosh, sorry.
I'll start the yeah, I had the music
Oh,
play, so I can't edit, but I can now.
dang.
So we'll
Okay.
start with take whatever time you need, and we'll just start with I just asked you the question, where can people go to find you and connect with you and your work?
Yeah, you can go to the reardonclinic.org website. You can also go to my Instagram is Laura Vasquez APRN, and you can find me there. I just started my Instagram for my work. I have a personal Instagram too, but I want to start doing more education and, get the word out.
An extra Instagram? You have two? I can't
Yes.
keep up with one. What are you doing?
No, it's confusing.
Oh my goodness, two. You said you had two kids. Which one was the daughter?
She's almost 9.
Okay, so she would be the one running the Instagram accounts. Then just give her the phone. She's going to be super proficient. Let her do all your social marketing. You'll be
Yeah.
fine.
More my son, he's 13. So, at that age, he teaches me things, he wants me to do a TikTok account, and he was trying to sign me up for this stuff. And I'm not an expert at social media, so I do rely on them to help. So I'm glad I have them and their knowledge.
That's awesome. Are they available for hire? Can I hire them?
Yes. Yeah. My son
That
is,
would be
he's
great.
really wanting to get a job actually, and he's not quite
Perfect.
old enough.
Done deal. I hate social media. Laura Vasquez, thank you again so very much for coming on our show today with all this education around something that's such an important topic. We really appreciate everything you're doing in this world to find a different approach to cancer and really help your patients out. So thank you so very much for everything you do. And thank you for being on our show today. We really appreciate you.
Thank you so much. I had a great time talking with you.
It was such an honor. And this has been another episode of Boundless Body Radio.